21 years ago, we saw a need, and these physicians and community leaders, along with myself, sat down and devised an idea of how we could generate some enthusiasm in the community for taking care of these patients. And the enthusiasm was simple. People are good, they're kind, they really want to help. But the problem was there was no institution through which we could work. And I think working with institutions are what's necessary. And we formed the Good Samaritan Clinic with a board and a lot of volunteer physicians and volunteer non-professionals who would help us raise funds, and with the good intentions of everyone and the need, sadly, that we've seen in our community, it has slowly grown and grown and grown to the institution that we are today. We see, on average, 4,000 patients a year. So you can imagine the amount of paperwork associated with that, the amount of personnel that's associated with that, calling these patients, following up, doing all the lab work, all the volunteer pharmacists that are necessary to dispense the medications which they're dispensed with from the clinic as free. In addition to the medical staff, we have a dental staff. We have a dental clinic which provides free dental care to patients in needs, and we will remove teeth, and over the last couple of years we started filling cavities. We try to save the tooth if it can be saved, and we've been very successful in getting volunteer dentists who are concerned about our community as well. So in addition to a medical staff, we have a dental staff, and of course pharmacists and nurses and other professionals who help us in our chosen goal. Well, the board, it's very interesting to think of what a board of directors do. When I first started with the clinic, I didn't realize the importance of the board. But to give you an idea of the importance, it's like having a family without parents. And it just can't really exist. And that's the way the board functions, in my mind at least. It really oversees everything that is done. It kind of directs without forcing the way things should be done. It observes and makes comments. The board really is the overseer of the clinic. And without the board, the clinic would not exist. It would have disappeared years ago. Just like without a director, without the CEO, the clinic would not exist. You couldn't coordinate volunteers. You couldn't coordinate doctors' times. You couldn't coordinate what needed to be done unless you had a person administrating the multiple tasks that are necessary. The clinic would not exist if there were no physicians who would provide the medical care. So all of these things are essential to the functioning of the clinic. And the board is the, as I said, like the parents of the family. And with good parents, with parents that care, with parents that are able to observe and make comments appropriately, the clinic functions very well, and it will continue to function well. Well, I think we live in a society where we are all under stress. We're all working very hard, particularly now with the economy as difficult as it is. But if we simply think about ourselves and our stress and our problems and what we have to deal with, we miss the greater view of life. It is not simply us. It is our community. It is all of us. We are one member of this humanity, of our humanity. And we always must, in the back of our minds, if not in the forefront or in the fore of our minds, we must always think of others at the same time that we think of ourselves. So when we help others, we also take ourselves away from our problems and in fact help ourselves as well. And I think all those people that volunteer feel the same way. We realize that no matter how difficult our lives are, it could always be worse. And when we take a few moments out to help someone else without any direct payback, without any concern except just helping another human being, it makes our community better. It makes our country better. It makes the world, indeed, a better place to live.